Okay, I think I figured out, I think I'm recording this. I guess we'll see when we're done.
Okay.
Hey, Amy, it's Jana. I can see a little button at the top of my screen now that says record. It wasn't there a little bit ago, so I think you got it.
I mean, it was hard. I pushed the button that said record.
That seems so obvious. It can't be right.
Right. I'm not sure how I'm done or how we get to it, but it's recording, so that's all I can do.
We don't know who it's recording to. So whoever's receiving this, you are welcome.
Hi, Amy. Hi, Molly.
Hello.
Oh,
Just wanted to say hi before we started.
how's your day going?
It's going all right.
Friday.
I was hoping like that it was going to be ending after this, and then I had a cancellation this morning. It wasn't really a cancellation; it was a reschedule to the afternoon. So now I go till 4:30, which is not my ideal Friday, but
Bummer.
that's okay. And I'm just happy that I arose from my basement. So my lighting's horrible, but that's not what we're here for. So
Right.
happy to have sunlight.
Yes.
Yes, for sure. Although just looking outside, it looks like it would be super warm out.
Yeah,
So,
and I'm thinking not.
I don't think so. Not that I've been outside today. I have not, but I think it's in the 40s.
All right. Well, you want to get going, Molly?
Yes, I was just trying to look and see if majority of everybody was here. Okay, welcome everyone to our presentation on autism. I feel like Amy and I started this a long time ago, and we had to keep changing it. And then with all of this, we thought, no, we're just gonna stay the course and get through all the information that we've kind of put together. So Amy emailed out the outline that she has shared. And we just decided to give you guys our entire outline with all of our notes on there instead of the shortened version that we had created to hand out in person, just since note-taking is a little bit more difficult when you're doing this via Zoom. So that being said, we have two separate sections open for questions. So if you guys would just jot down a question if you have one as we're going through, and then when we get to those spots where we've allowed some time for that, then we can circle back and answer any questions that you guys might have. But today we're just going over really the process of kind of starting with having a conversation with the family about autism, and then moving through the next steps through that entire process, all the way through the evaluation and possible outcomes after having a diagnosis of autism and what that looks like for us in terms of services provided. So we will start with just having a conversation with a family about autism. In some cases, this can be something that's pretty dreaded, but it can also be something that turns out to be pretty positive. I think one big takeaway with this is that it's different for each and every family. So there's no one way to follow through with this. So some things just to keep into consideration is, have they asked you directly about autism? That's always kind of the easiest. It just opens the door for that conversation. They're ready for the information that you're going to present to them, and they're wanting your feedback of what your thoughts are. A lot of times families will ask about autism indirectly. So they'll mention characteristics, but maybe just not the word autism, which, you know, through some careful conversation and coaching, typically we can get, have a nice conversation about, you know, what we're seeing and what they're seeing, and then move forward from there. But then we also have those families that don't appear to be aware or have concerns with autism, even though you might. So with that, for all three of those, some questions to consider before starting a conversation or engaging in a conversation would be that to ask them if the doctor has mentioned any specific concerns, or if they've done any screenings for development at a well check, which we will talk about the MChat later. But that's one tool that a lot of pediatricians' offices are using, even if there are not concerns. They're doing it at all well checks. So most of them will be able to share that with you if they do have that. And then gaining what the parents already know about autism so that you can be sure that you're meeting them at their level of knowledge. And then what are some things their child is doing or not doing that they are concerned about. Sometimes that you can bring this up with families, to especially those families that don't appear to be aware, or maybe they've asked you indirectly with mentioning those characteristics but not saying the word autism, is to talk about this if they are either just coming out of a well check with their pediatrician or getting ready for that well check during a 6-month IFSP review. And if, or even without doing a review, if you're hearing some, you know, concerns from parents that progress just isn't being made the way that they were, you know, envisioning or hoping that it would be. So once you have, you know, those things kind of set up, then there's some things that you just want to take into careful consideration. So we want to avoid using the term red flags. I know that we've talked about that in team meetings, but the word red flag is a red flag to parents. You know, it just kind of, I think, is it brings on some anxiety. So sharing concerns using the words characteristics or concerns surrounding autism feels like it's just a little bit more delicate. It's very important that families understand that we cannot diagnose. We are not here to diagnose a child. We are just here in the capacity to support them through the process, and that process is whatever is best fit for their family. That they're totally in the driver's seat with that. They are in charge. You're just there to guide and facilitate them through that and offer support. A lot of families will go to their doctor and say, well, my early interventionist or my therapist at ITS said that he has autism or diagnosed with autism. And that's not, it's very important that we explain that to parents over and over, that we are not diagnosing, we're just having that conversation with them to support and guide them through this process. And also during evaluations, there are times that parents will bring up autism or kind of, you know, talk about things, some characteristics that make us think that maybe they've researched or done some research on their own. It's best just to focus on eligibility for our program. If they should bring it up with you, just encouraging them to discuss that further with their assigned primary service provider, and just ensuring them that they will receive support from us during that process, whatever it should look like based on their needs and wants. So we touched a little bit earlier on the MChat. That is a tool that we actually have it's available for you guys to use. It's the modified checklist for autism in toddlers. It's a checklist of about 20 questions, and you can find it on mchat.org, or we actually have a copy saved in our FTP file. And any of us are able to complete that. It's been done before where parents will fill it out on their own. And, we just try to support the parents with that. It sometimes works best, I think, if you are able to complete that with a parent. One of the most important things to keep in mind is that you don't want to fill that out on your own by yourself without the parent's knowledge or understanding of what the MChat is. We want them to be involved because we want to take their information and the way that they are viewing their child's progress and development to get the results. And the way that the results, or that you kind of come to the end of the questionnaire, is it has a grading scale. They're all yes/no questions. It's all laid out in the directions for you on the first page that you'll find. But based on the number of yes and no questions, they'll get a score, and that score is divided into low risk, medium risk, and high risk. Now, let me back up for a minute. So when you're completing this with parents, it will ask questions, and yes, no questions are hard because a lot of times parents will say, well, she does sometimes, or he does that occasionally or sometimes. So kind of a general rule to follow with that is to help guide them by giving them an example of what that question is asking, a little bit more specifically to closely related to a skill that that a child at that age typically developed should be doing. And then asking them, do you think he or she can complete that task, 50% or more, or less than 50%? And if it's that 50% or more, you're obviously going to give the answer as a yes. And then for less than 50% would be a no for that answer. So it's also important to, that all being said, follow a parent's lead. So even if you don't feel like their answers are correct after you've kind of explained and helped them through that and offered support that way, it's important just to allow their score, or that score, to reflect what they feel their child's abilities are. And that can be a little bit difficult to do, but we try to always keep in mind that as long as we are presenting them with all of the information and giving them as much support as we can, we're doing our job. We're putting that thought in their mind. We're helping them, move forward with the process. There's times that families that we feel very strongly, would benefit from going through further evaluation for autism, even after doing the MChat, and maybe the scores aren't reflective of what we thought it would be. Or there's families that, or children that will score in the high risk categories, and families choose not to follow through with that by having a diagnosis, or, seeking to see if there can be a diagnosis. And it's just important for us to know that no matter the outcome, as long as we're giving them all of the information that we have and supporting them in every way that we can, we're doing the best. We're doing our job, and we're doing the best that we can. I also do tell families a lot that having a diagnosis doesn't necessarily change anything that we are going to do on our end in providing support at home and supporting their family. But that if their child does receive a diagnosis, there are opportunities for more support for their child and their family outside of what I can do in the capacity that, we're allowed to with our home visits. Okay, let me get my bearings here. Amy, am I missing anything?
No, I think that sounds good.
Okay. So now we're on to, let's say that you've gone through, you've done the MChat. They've been at, I did not mention this. So if they score in the low risk, typically that means there's no further action necessary. For a medium risk, you can choose to either follow up, and there's a follow-up MChat that you can go that goes a little bit more in depth. Or a follow-up could look like you're just going to wait a month or 2 or 3 and then revisit the MChat, or open up another discussion with the family about how they're feeling. Or you can refer with the information that we have for an evaluation for an autism diagnosis. The high risk, if they fall within that high risk, it also is that it's recommended that we refer for an evaluation, but obviously it's ultimately up to the parents. So let's say though that you've done the MChat, you've talked with the parents, you've gone through the whole deal, and the parents are ready to move forward with an autism evaluation. So Amy's going to go over this section, kind of what's next. We're ready to move forward with the evaluation, and then where do we go from there?
Okay. So just kind of a side note also, a lot of this information that we're sharing today, I'm sure a lot of you have gone through this with families or might have, similar or different experiences, but these are just kind of the things that we've learned as we've gone through this with families many times. Once you kind of have a family that's ready to move on with an autism evaluation, sometimes they've already done some research themselves, or their doctors have given them referrals to certain places, usually Children's Mercy or KU. But if not, if they need some information about what to do next, we do have in the FTP a resource sheet of places to call for an evaluation. This is not necessarily an exhaustive list. I'm sure there are other places, but we've tried to do a little bit of research and figure out what are some of the most available places for families to access in Johnson County. So the sheet that we have, I have found it helpful to make sure when I'm sharing this with families, to make sure they know that the list is just simply in alphabetical order. It's not the top place is the best place, and on down the list. I think it's important that we don't necessarily recommend one place over another. Kind of just give that information to the families and let them decide for themselves and do some research to figure out what's going to work best for them. One thing I've kind of noticed is some families do, once they kind of reach this point and they know they want to go through with an evaluation, some families do feel a bigger sense of urgency. It's in their head. I want to get it figured out. I don't want to wait. If you have those families, you might guide them in the direction of looking at that list where there's some private practice psychologists that do evaluations, only because in the past they've been able to get families in a little bit quicker than like Children's Mercy or KU. If they're not in a super big hurry, or they want to wait, or they're okay with a little bit of time, just let them know that chances are there will be a wait list that could be upwards of 6 to 9 months to get into KU or Mercy. But sometimes I say that and then parents call and they get in a month later. So it's really hard to say, and I think it's continually changing. And obviously, currently right now at this point with the situation we're all in, this all is probably not even relevant. But in normal times, this is kind of the information that we have. So last time I was at an eval with the family at Children's Mercy, I talked with the doctors and the eval teams that were there to just get some information about what could help families not have that really long wait list. Because I've had families call and say, they told me it's going to be 9 months or a year, I can't get in. They'll call me in 9 months to schedule, and that's really frustrating. So some of the information I got was they think it's very important when families call, when they're talking to the intake people, to be very honest and descriptive with what their concerns are. I know families are oftentimes nervous or scared and might downplay some of the characteristics or concerns that they're seeing. But the more, if there really truly are concerns for autism, the more they can describe what those are that sound potentially like a child with autism, that will help the intake team kind of funnel them to the right department for scheduling. And I found this helpful with families, especially if you think they might have a challenge with this, that during a visit, sit down with them and write out some characteristics that they can just look at that list and share that information when they call. The other thing that they mentioned was it's very helpful for the eval teams to have a copy of a child's IFSP if they're receiving our services. And I don't think most parents would know to even ask if they want that. So it might be helpful for you to suggest to the family for them to ask if the eval people want a copy of that. And then they should have a copy of it, the family should, or you can email it to them again and they can forward that on. So those are some of the main things that I've been told and found to kind of help that process move along. Okay. So the next part I'm going to talk about is kind of what you can tell families to expect an evaluation might look like. I found it really helpful with my families who are getting ready to go in for an evaluation to kind of give them some of these heads up and pointers with what they can expect that day. As you can imagine, they're nervous and scared and not sure what's going to happen. You know, it might look a little bit different from place to place, but in general, this is kind of what it's looked like. Usually these evaluations last 3 to 4 hours. I've been in some that are a little bit less than that because, you know, a 2-year-old's only going to cooperate for so long. I have a lot of families that will ask me if there's going to be blood work or anything like that, and that's not what they're doing. It's all observation and behavioral kind of assessments that go on. Typically, if the evaluation is happening in a hospital like KU or Mercy, they're going to be brought into usually a pretty small exam room. There's usually a team of at least 2 people, a developmental pediatrician, and there's usually a psychologist or an OT or speech person in there with them. At KU, I'd often see additional med students in there since they're a teaching hospital. And the family's in there and the child's in there. Typically, they'll start with the child having some toys available, and one of the evaluators will be attempting to interact with them, kind of gather some initial information about their play and their interactions, while the other evaluator is spending time asking the family about family history, medical history, current services that they're receiving. A lot of the questions that families have answered over and over again, they have to go through that again. When I have joined families for these evaluations in the past, I usually try to just sit and be there and be quiet unless I'm asked a question, because I have found that the evaluators really do want the information coming from the parents. And then if they need additional information, they can ask me or clarification. But it has been helpful for some families to have me join just for that support. And some families don't want that. So either way is fine. Once they've kind of gotten through that medical and family history and done their observations, typically that team of evaluators will leave the room for 15 to 20 minutes, and they leave the family and the child in the exam room. And what they're doing is going to another room to look at the evaluation criteria and discuss what they saw and make their determination. So I found it really helpful to let families know that most of the time they're going to get an answer that day of what the team thinks. So even if it's going to be hard for the family to hear that word autism for their child, at least they know to expect that could happen, kind of can prepare themselves for that. So then once the team comes back in the room, that's when they typically go over their information and the results that they're going to give that day. Usually what happens next is they start piling on a bunch of paper and resources and information for the family, and it gets very overwhelming. So I usually like to tell the families, take that information, try not to worry too much about it at that point, take it home, process it later, try not to really focus on that pile of paper too much. I've also find it helpful to let families know that our next visit at some point after they go could be going through all that paperwork with them and really helping them decide what is relevant for their family, what is maybe not helpful or useful at that moment, because they'll feel like they have to go through it all and they don't necessarily have to at that right then at that moment. If they're doing an evaluation in a private practice, like with a psychologist, usually that process looks pretty similar. I have found that some of the psychologists will schedule sometimes 2 or 3 visits instead of just one, to kind of give them time to get to know the child. But essentially, they're doing the same kinds of things. And once they're done with that, they usually give the results. So let's see. The next little information we have is once a diagnosis is given, kind of what that kind of looks like. And they used to, when they were doing evaluations, they would give labels such as mild, moderate, severe. They might put specific things like PDD, NOS, or Asperger's, and they've really moved away from that. In the last couple of years, you don't see those terms used really at all. Instead, they're using kind of a level system, and in the reports, parents will often see that their child is listed as level 1, 2, or 3. And I've asked about this at KU and Mercy, kind of what that means, because I found that oftentimes they don't really talk about this level that's assigned to the child when they're talking to the family. A lot of times families figure it out once they've read through the report, and then kind of freak out sometimes when they're not sure what that means. What it's been described to me as a lot of times these levels are reflective of the level of support that the evaluators feel like the child needs in order to make progress. So I'm sure some of you may have different experiences with some of your kiddos, but many of the kiddos that I have had go through this process oftentimes end up with a level 3 at their evaluation. And I really think this is due to the fact, like we know, how important early intervention is. And the amount of support these kiddos need at this time is usually pretty high. So oftentimes parents will still ask, well, are they more mild, or are they more severe? And I usually try to just redirect them back to this level system, or ask them to really call their doctor or their evaluation team and ask them about it more, versus us trying to figure out where the child really is at that time. The other pretty standard recommendation, as I'm sure most of you who've at least gone through this process before know, is almost always they're going to give that 25 to 40 hours a week of ABA therapy. A lot of times that's pushed pretty heavily in those evaluations for families to get into that as soon as possible. Oftentimes families have no idea what that is or what that means. And so I usually tell them, let's take a deep breath and let's talk about it once you kind of have time to process what's going on and look into what that might mean. The other thing I have had happen often is they will frequently tell the families they need to increase their support through infant toddler. And that's not always necessarily untrue. Sometimes we do need to add some additional supports for different things that we need. But what I think is important to share with families is we can always look at adding additional support on our teams, but we are not obviously going to do 25 to 40 hours a week. So what we do is, as we know, very different from that more direct therapy that ABA would provide. So I think that's just an opportunity for you to have a conversation with the family about what they really are wanting or needing from us, what additional supports they might need, and if they are requesting more than one visit a week, really talking with them about what that could look like, and how we could continue coaching with them versus that turning into direct therapy. Okay. Molly, I'm going to flip it back to you.
Okay, forgot my mute button was engaged. All right, so some resources that we have to offer to parents is that blue resource packet. We typically, when we were meeting in person for team meetings, would have one or two there just for anyone to take if needed. And there's a bunch of them located at the office. But what this blue resource packet includes, for those of you that are not familiar with it, there is a Hannon book, and it features Hannon communication strategies that offer support for families using those Hannon strategies to encourage and promote communication. There's also an ESDM book in there, and that follows the Early Start Denver model. This is written for parents. It's organized like a textbook, but it's a super easy read. There's also a 10 Things book, and that's 10 Things Every Child with Autism Wishes You Knew. And that gives a perspective into the life of a child with autism and how they process the world around them, which is enlightening for a lot of families and all of us to look at, especially when trying to navigate and how to support children with autism. There's also a 100-day kit from Autism Speaks, and that's a kind of a summary on the first 100 days and kind of what to expect and what that looks like for the first 100 days after receiving a diagnosis of autism. It offers special considerations for families navigating life after a diagnosis. And then in there, we have just a one-page handout of just different resources and therapies and links that the families can use. It's okay to give parts of this packet and reserve some for later, because the family, after they receive this diagnosis, comes home with a lot of information on top of everything that they've done on their own through research. So it's okay for you to kind of split that up. That being said, before you hand this to a family, it's important that you guys are really aware of every resource that they have, so that you can pick and choose what you share with the family, and that you're knowledgeable and can go through each part with them. You wouldn't ever want to just hand the packet over to them and say, here you go. That would be probably more than overwhelming to them. So for you just to support them even further and go through each part of those, each part of that packet with them would be super helpful for them. And I know families that I've gone through that with have even helped me pick out what they feel like they need at that moment. And then they've asked me to hold on to the other pieces. And then when they were ready, I could bring it back, or they took it and put it away. But either way, just for them to have that information. We also have additional resources in the FTP file that just go over, there's an autism file in there, and you can find resources on sleep and behavior, potty training, feeding. So that's a really great place to look and research as well. Okay, so as you can see, we have a section for questions. I think we had a couple come through on the chat button. I don't know if Amy, if you click that, if it will share with everybody. Down at the bottom. I have mine pulled up. So you're muted. I can't hear you.
I'm not seeing it.
Okay. So Sue asked if we recommend doing the CARS 2 as a follow-up if they are at a medium risk.
I haven't done that recently. I don't think it's a bad idea. We used to do that when we had that partnership with KU. That was one thing we did, and I think it gives some really good information. I don't know, Jana, have you done that with any of your families recently? I don't know if Jana's still on here.
I can't figure out how to unmute myself. I have not, because we don't have any protocols that I can find anywhere. Sometimes I will throw in those questions when I give examples. Like I think it was Molly was saying, when you're doing the M chat and it's a yes or no, then I kind of use that CARS as a guide to give me some ideas to give to them.
Yeah. So the CARS is the Childhood Autism Rating Scale. And like I said, we used to use that when we had that partnership with KU, and we would do a lot of the assessments and then we'd send a report. So, I mean, I guess, Sue, I would say if you have protocols, I guess it wouldn't hurt, but I don't know that we have any more for other people to use, since we're not really doing that with KU anymore.
Okay, so we're not getting them anymore then.
I don't think so. Not that I know of. I mean, we
Okay.
can double check with Monica, but I haven't seen any for a while.
Okay, yeah, I had a couple stashed.
Yeah. I probably do somewhere.
Okay, the next question is from Nadine. If we do the MChat with a parent and it comes out as low risk, do we address what we're thinking and our concerns?
I think you always can, because, what I see sometimes is, like Molly said, we have to kind of follow a parent's lead. We can give examples and suggestions, but if they're answering it the way they feel they want to answer it, it may not always necessarily reflect what we think is really going on. So I've had that happen where, I have concerns and we do the MChat and it comes out pretty low risk, even though in my head I know there's more going on. I think some of those MChat questions, when you look at them and read them, it's pretty easy to figure out what the answer should be, for typical development. So I feel like sometimes families will answer that their children are doing things even if they're not. So I think definitely it's okay to continue to address your concerns, even if the MChat score doesn't reflect that. And like Molly said earlier, we can keep doing that, but sometimes we run ourselves in the ground trying to get parents to see what's going on, and they still don't. So at some point we have to just be okay with, we have given them information, and it might be once the child's 3 or 4 when they finally process all that there really is something else going on.
And then Nadine, you had a follow-up question that have we ever done the MChat follow-up when it comes out as low risk? And I think to piggyback on that, I have, but I think it's easier because if we're doing the MChat, we've already had the discussion and I've told them, they've shared their concerns and I've shared mine, and we've talked about autism. So sometimes when it's low risk, depending on my read of the family and how kind of my takeaway of how they're feeling once we get to that point, I will say, just to kind of keep it out in the open, keep an open recommend that we keep an open communication about that, and then maybe revisit at the next review or the next well-child check. So then you can kind of circle back around about progress that's been made. You're looking at the AEPS-2, and then it kind of facilitates you being able to bring that back up into a conversation and then try that MChat again once they're a little bit older. Feel free to unmute if we didn't answer your questions too. Okay, the next question is from Stacy Pate, and she wanted to know that she's asking that the age range for the MChat is 16 to 30 months. And then what screenings do we have if the child is not within that range?
So I think there, and maybe Jana, you can jump in here too if you have more information. I think this is where it gets tricky. There is another screening, and I can't think right now. I don't remember exactly what it's called for kids a little bit older. I've done it in the past and I didn't necessarily find it super helpful. I wonder if that could be, if you have access to the CARS protocol, just to give you some more information, that could be a time to use the CARS. But Stacy, I would have to kind of check and see, maybe with Monica, if we have the other screening. I can't think, or Sue, do you remember what it was called?
I remember using it when we were doing the the process with KU, and I can't remember the name of it either.
I thought it was
might-
I thought it was red flags.
Yeah,
I think that's what it was, a red flags checklist, and
Yeah.
it was
Uh-huh.
junk, I thought. I didn't care for it.
yeah, it didn't really give any, I mean, it was just a bunch of questions, but didn't necessarily
was.
give any direction or any kind of scoring. I don't remember.
Mhm.
So, that MCHAT, it does say it's for 16 to 30 months. To be 100% honest, if you ask me if I've done it with kids older than 30 months, I have. I don't know if, we can say it's not super applicable at that point, but I feel like,
I have too. I've used it with kids that are over 30 months as well.
I have two, just because there's I don't have any red flags with the forms anymore. We didn't have anything else really.
Yeah.
Except the cars too, which I did use.
yeah. And I feel like even if we are, doing it for kids a little bit over 30 months, it's a month or two over 30 months. It's not like we're doing it with a five.
Yeah, right.
Okay, were there any more questions? I don't think I see any on our group chat.
Okay.
Okay.
Awesome. So I'm going to, let's see if this will let me, there we go. I'm going to move on. We have a little bit more kind of moving into, once a family goes through that evaluation process, gets a diagnosis, and gets that recommendation of ABA therapy, kind of what happens next. So I have here, when the family asks about ABA or ESDM, and like we said before, there's lots of different approaches. These are not the end all be all approaches to use, but these are two of probably the most common or frequently heard about approaches. So I don't want to spend a whole bunch of time right now necessarily talking about really what ABA is or ESDM. That could be a whole nother huge long discussion, but just to give you an idea, if you're not sure and a family asks you what is ABA, first of all, it stands for Applied Behavior Analysis. It's a very highly researched strategy for children with autism. It's a very much a behavioral approach, looking at skills or behaviors that we want to change in children, and kind of breaking down those skills and behaviors into smaller steps. They use a lot of like task analysis approaches and really work on, building skills up through lots of repetition and structured kind of practices. It's very systematic. There's lots of data that's taken. So there's some of you that, like me, maybe Erica, if you're on here, like that kind of stuff, and some of you think that sounds terrible, but it's very data-driven approaches that really uses the information that they gather through their daily practices to figure out when to move on to new skills. It's used for teaching lots of different kinds of skills, communication and social skills. It can be used for gross and fine motor, really any kinds of behaviors that we want to change in children. And then to kind of contrast or compare that with ESDM, which is the Early Start Denver model, the ESDM practices are really kind of taken from or based on approaches of ABA, so they're not necessarily two different things. Having gone through the certification process for ESDM and also being a BCBA and done all that ABA training previously, what I think the main difference is in those two approaches is the ESDM really tries to focus on more play-based approaches and is geared more towards children from about 12 to 48 months old. That's not to say that ABA is not geared towards those younger children, because a lot of times they do start at a pretty young age. But I think some of the practices in ESDM lend themselves or lean a little bit more towards following children's lead in play and in routines, where some of the ABA practices might be a little bit more structured and kind of led by the therapist of what they're going to work on. So that's kind of a quick nutshell. I'd be happy to talk with any of you other times if you have questions or are trying to help families understand what ABA might be without getting too detailed. Just another couple terms that you might hear when you hear families looking through ABA programs or trying to learn about them is a BCBA and an RBT. And these are the different kinds of therapists that are going to be working with children in those programs. A BCBA is a board certified behavior analyst, and they are the people who are typically doing the assessments when children first come into the program. They're developing the programs that are going to be run and doing lots of the training of the technicians who are doing a lot of the day-to-day therapy with the children, which are those RBTs, which stands for Registered Behavior Technician. So those are people who have gone through a series of several hours of very specific training in ABA and are certified to be providing this type of therapy supervised by a BCBA. So a lot of times you'll hear families talk about their children working with the BCBA or an RBT, just so you kind of have an idea what those terms stand for. So just like when families are ready to go through an evaluation, once they're ready to look at ABA places, if that's the direction that they want to go, we do have a resource list. Now, most of the time families do get a pretty extensive list of different agencies in the Kansas City area that provide ABA therapy from KU or Mercy or whoever's doing their eval. And that list is several pages long, often has agencies on both sides of the state line. Families can absolutely use that. What I found helpful though is the list that we have is just Johnson County. So it kind of helps families narrow down a little bit what they're looking at. I will tell you, we've been working on this list for a while and are often trying to update it. And I feel like at any given time, it's not truly accurate. I feel like these ABA programs are popping up all over the place. I just had a family a few weeks ago that started with an ABA program that I'd never heard of before, that I think just opened up within the last year maybe. So, and I have a lot of you oftentimes that will email me and ask, have I heard of this place? Is this on the list? So I appreciate when you do that if you hear of new places, because it's hard to keep up with all the options. So again, just like with our list for evaluations, this list is in alphabetical order that we have for families. It's really, I think, important for us to not, again, recommend one place over another. And this last year, I feel like I've been able to do kind of start gathering some of this information about different factors that families might be considering when they're looking at an ABA place. And so, you know, one place might be good for one family, and the next family, that place may not be the best fit. So even if we know of certain places, I would lean more towards giving them this handout and telling them to just start calling, but also maybe spending some time talking with them about some of these considerations. So things for families to consider, so they kind of know what to ask. Because that's the other thing I found is families don't know what they should be looking for or should be considering when they're calling an ABA program. And it's very overwhelming to try to figure that out. So this list here is just some of the things to kind of think about when they're looking. So for most places, the child does have to have an actual diagnosis of autism and the full diagnostic report before the ABA centers can begin services or even begin looking into them. Oftentimes, families will get like a one-page summary the day that they leave their evaluation that says they do have a diagnosis, but I've had a lot of centers or heard of a lot of centers that won't take that. They need the full diagnostic report, which sometimes can take 4 to 5 weeks after an evaluation to get that from the evaluation team. One of the first things I feel like is super important for families to check into is their insurance, and does their insurance cover ABA? And then once they call an agency, that should be one of their first questions is, does the agency take their insurance? The good news is many more insurance companies have been covering ABA in the last couple of years than previously have been. And I think a lot of these ABA centers also have a dedicated person that's what they do every day, is deal with that insurance, which I think sounds terrible, but thankfully somebody does it. So they are pretty used to getting those questions from families. The next thing I think to have a family start thinking about is, how do they feel about their child attending somewhere for 40 hours a week? They hear that's what they should be doing. In some families, doesn't matter what they think, if that's what the doctor says, they're going to make it happen. But some families don't feel comfortable with that. I think there's absolutely benefits to this type of intervention for kiddos, but on the flip side of that, I think it's important to remind families that this is a very intense approach, and it's kind of like sending their child off to a 40-hour-a-week job. So you have to kind of think about, how do we feel as adults after 40 hours of a full-time job in a week? Especially right now, I think we're all a mess by the end of 40 hours. So think about putting a 2 or 3-year-old through that. Is pretty rigorous sometimes. Children, though, are, as we know, very resilient, and they'll adapt to those schedules pretty quickly. But I think it's important for parents to think about that, and how do they feel about that. And I think it's important to make sure families know that it's their child, and they have the ultimate say in what their child is doing, because oftentimes they'll go to these centers and be pretty highly influenced or pushed in the direction of going 40 hours a week. So if they really don't want that, they really need to kind of stand up for what they feel like they want to happen. The other thing to kind of think about and consider, especially if a child is approaching 3, is, does the family think they're going to want to try to do part-time ABA and part-time school through the district if their child would qualify? And it's so hard to know some of that sometimes. The families, they can't think that far ahead, or we don't know if that's going to be an option. But I do say to think about this, because if they're a family who would need transportation between those 2 places, it's going to be the same kind of story as if the child was in childcare, that they could only be transported by the district if the ABA center is within their school district boundaries. So if you kind of know a family's leaning in that direction and would need that transportation service from the school, that might help them kind of narrow down which centers they start calling. I found it really helpful to suggest to families that they ask to go take a tour as they call some of the centers, and try to tour more than one. I think this is when they really kind of get a good picture of, first of all, what ABA looks like in any of the centers. And I've had the chance the last year to go to, I don't know, probably 6 or 7 different places at this point. The underlying theme of what's going on is, for ABA therapy, is the same, pretty much the same, but there's different aspects of different centers that some families might feel more comfortable with. Just to give you an example, I had a family last year that I think they toured 8 different centers. They were serious about figuring this out exactly for their child. And they came back with things like, one of the centers is in an old dairy barn, and the top level of this place is a Montessori school, and the bottom level is the ABA program, and it smells like cows. And they didn't want their child in a barn, essentially, all day long. There's some centers that are in the basement of churches, in some of the rooms that used to be preschool classrooms. There's one in Lenexa that many of us know about that's in an old house. There's some that are just in the typical kind of, strip centers, strip malls, in various places in the county. So they all can look very different, and sometimes that matters to families. And it's very similar, I would say, to researching a daycare facility, kind of to go there and see how you feel, and would you feel comfortable leaving your child. The other question that I have had families ask a lot is if the ABA centers will offer additional therapy such as speech or OT. And what I found is many of them, at least in our area, don't have those therapists on staff. There are a couple centers that do. And for some families, that's important. They want their child to have that additional therapy as well. Some families, it's not as important to them. Sometimes it helps explain to families that a lot of what ABA is going to be working on, especially with the early learning skills, actually targets some early speech or early motor skills just in what they're doing. So they don't always necessarily have to have a separate therapist for those to work on those skills. But if that's important to the family, you might just let them know that they need to be asking about that if it's an available option. Of course, they can always ask about the wait list and how long that might be. It's pretty common for there to be a wait list. Sometimes it's not very long. Sometimes it's 3 to 6 months. I've had some centers that I think put priority on certain types of children, such as, one place tends to prioritize the younger kids under 2 or under 18 months. They get them in quicker than maybe some of the older kids. And some places are the opposite of that. So I don't know that they necessarily tell families that's what they're doing, but there's often a wait list. But then I've also had some families call a center and poof, 2 weeks later, they're starting services. So you just never know. And then lastly, for a consideration, I do have some families that have asked, is center-based option the only option to go to a center? Do places offer in-home therapy? And from what I've learned from some of my research, I think there's a couple different agencies in Johnson County or in the area that do only in-home. A majority of them are center-based places right now, but there are some that will do a combination. Maybe do part of the therapy at the center and then some in-home therapy. So if that's important to the family, to have it one way or the other or a combination, that would be an important question for them to ask. So that's the end of some of the considerations, at least that I've come up with. Some of you may have some others that you've helped families through, but I'm going to let Molly kind of wrap it up with this last little part.
Our last section is kind of what do our services look like after or once they've started attending ABA therapy. And this is our last section until we'll answer some questions and then we'll be wrapped up. So in my experience with the families I've worked with, when they've started ABA, they'll start out a little slower and then kind of progress and increase hours just to get the child acclimated. So that's something to kind of keep in the back of your mind if the family is going to work towards full-time. But if they're going to attend, the child's going to attend ABA therapy part-time, this often leaves time for us to continue with services supporting, their supporting the family and the child in their daily routines at home. We're just obviously working around that time schedule that child is at ABA. If the child is in full-time ABA, they're obviously going 8 to 4, which that leaves us with evening visits, which can be done, but it's pretty hard sometimes because they've obviously been at therapy intensive therapy all day long away from their family, and then they get home ready to relax and unwind, and then you're there. So not that it can't be done, but sometimes it's a little bit more of a struggle to feel like we're really able to support the child and the family when they've been at ABA all day. So if you are still on and you're still working with the family and they're going to ABA, it's important to attend meetings at ABA with the family. They typically will meet, the family will meet with their BCBA and RBT, kind of to hear about how things are going, what skills are being targeted. The importance of us attending that meeting is that it gives us an insight. I kind of explained to parents that it's our way to be a bridge between ABA and how we support them at home to further impact what they're working on at ABA and support the family to embed those similar skills from ABA into their daily routines at home. If the family does not want services, sometimes we'll get families that just feel like they're moving on with ABA. That's the decision. It's a lot, especially for those families that are taking their child full time. Typically, our first stop is to offer to stay on as FSC, especially if we think the family, or if the family thinks that they might be interested in that transition at 3 years. That way that we can stay on, check in with the family, support them if they need it, and then obviously support with that transition piece if that's the path that they decide to take. There are times that families are not interested in school services, and they will often choose to discontinue ITS services. Although that's not the outcome that we always, want to follow through with. Again, it's following the family's lead and, supporting them. And if that means by discontinuing services, then we, offer those wishes, obviously, which it feels like kind of a depressing way to end, but that's all we have. Okay, so I see another question pop up. Let me see if I can. Okay, so Nadine's question is, are we typically well received by the ABA team when we attend meetings with families? And I have been well received. I feel like it's been a positive impact. Amy and I were talking about it, though, that the main important thing to do is, it's kind of both of our thought process, that ABA is not going to take what we're doing and change what they're doing based on what we're doing, but we can take what ABA is doing and change what we're doing at home to further support those daily routines at home.
I would say, sorry, are you done?
No, I was going to ask you, what's your experience?
I would say, luckily I've had the opportunity this last year to visit, like I said, 6 or 7 places, and several of those I visited with a family that was wanting support when they were trying to decide on a program, which I really like that. It kind of gave me an in to be there and help ask questions and not just show up by myself to tour their facility. But I did ask that at every place I went to, is how do they feel about collaboration with us, and us, like Molly said, attending some of those meetings. And not that we have to attend all of them, but on occasion attend a meeting where we can just hear what they're doing and help carry those activities over to home. And I would say 90% of them were instantly said, yes, absolutely. Here and there, I'd have someone with a little bit of hesitation. And I just wonder if they, I just kind of got the idea, maybe they felt like we were, trying to, I'm not sure, check up on them or overstep our boundaries. And I was just really clear to make sure that they understood we just want to collaborate with them and work together. Not trying to say that anybody's approach is better than the other person. So I would say, for the most part, yeah, I think it's been very well received. And I've been able to go with some families the last couple months to some of those meetings, and it's gone pretty well when they see that we're really there just to collaborate with them.
Okay, and then a follow-up regarding the CARS 2, which Sue, maybe you can help us with this, but are you explaining to parents you are using it more as a screening tool, not an assessment?
Yeah, for sure, for sure, for sure.
I
You
think
make that clear up front that it's not a diagnosis tool at all. It's just, especially if they're borderline on the MChat, it doesn't give a lot of information sometimes, or enough for some families. So it's the next level. Well, we're still not sure. What do you think? Should we call? Should we not? Da da da. And then I just use that. Well, let's look at it further and get some more detail, and maybe that'll get your answers you're looking for, kind of thing.
I think that just goes back to even what we were saying earlier, that we have to be very clear with families that we cannot and are not diagnosing a child, that our job is just to share concerns with them that we see that might, be characteristics of autism, but in no way are we giving it a diagnosis that has to be done by a doctor. Okay, were there any other chat questions, Molly?
no more. Does anybody else have any questions or comments they wanted to add?
Okay, maybe not. Like we said earlier, I'm sure a lot of you who have worked with families through this process probably have your own experiences, and they may not be exactly what we put on here, but we just kind of hope that this, especially if any of you run into some families from time to time that are anywhere in this process, just to kind of give some more information and tools in your box that you can kind of fall back on. So there are no other questions.
Thank you guys. I appreciate it very much.
Sure.
Ladies, that was great.
Yes, thank you guys.
Thank you.
Your day.
Thank you for joining us.
Amy.
Helpful. Thank you.
Have a good day.
Happy Friday.
Are we doing happy hour?
Thank you,
Happy
Amy.
hour.
You guys, we should have done happy hour during this. What were we thinking?
Right.
So much more.
Good
One more
message.
meeting. I can't do it yet.
Thank you.
Yeah, some people still have to work this afternoon. Darn it.
Oh, yeah. Sorry, Laura.
Yeah, thanks. Bye.
Bye.
Click, click, click. They all click off.